Hey guys, welcome to my channel Pharmacy with Preeti. I hope all are doing well. So in today's video, I will be covering NSAIDs, also referred to as non-steroidal anti-inflammatory drugs. Now, what is steroids? Steroids are basically a complex cyclic structures which are meant to increase the effectiveness of the supporting drug. Okay, so basically these steroids are used by the practitioners along with other medications in order to enhance their effectiveness activity. So in this chapter we are going to deal with the non-steroids. Okay, something which is not a complex structure and which does not contains any kind of cyclic structures in it. These non-steroidal anti-inflammatory drugs are meant to relieve are meant for pain relieving action. So let's begin. Before starting with the actual topic, I will give you some basic introduction about it. The basic terms we are going to discuss firstly. So starting with the pain. Pain is an unpleasant sensation which is occurring in varying degrees of severity as a consequence of injury, disease, or any kind of emotional disorder. So what is pain? Pain is something which is undesirable and it happens to a person when he or she is under severe has undergone severe injury or might be suffering from any kind of disease. Okay, or the person who is depressed, so there is emotional pain which is happening to that person. So this pain is undesirable, right? And it's a kind of sensation which varies. We can say the degree of pain, it varies from person to person depending upon the injury that the person have. Let's consider a person has met with an accident. So if the accident has if the accident which was happened is major, then the pain would also be major for that person. And if there is a minor accident happened to that person, then the pain will be mild or it will be mild. So these NSAIDs are useful for the treatment of pain. Okay, now what is analgesia? Analgesia is the those properties of the drug which is having pain relieving action. Okay, it is having pain relieving action. Either these drugs may act centrally, that is in the CNS, or the peripheral, or it will act locally, that is at the site of pain or at the site of injury. So this NSAIDs basically does not have any role in the CNS. This NSAIDs, that is non-steroidal anti-inflammatory drugs, are known to show its action locally or at the site of injury, at the site of pain, without affecting any consciousness. However, the person who have met or who have undergone major surgery or major operations, the doctors mostly prescribe them with the opioid drugs. These opioid drugs are centrally acting drugs. This will directly act on the receptors which are present on the CNS. So thereby reducing the pain. Okay, during surgery operation, the person undergoes a very harsh pain. So in order to relieve the pain from the patient, the doctor usually prescribe them with the opioids. Okay, those drugs which is having a direct effect on the CNS. However, the continuous use of these opioids may be it has a habitual effect. Therefore, these opioids are not generally prescribed to all person who is under pain. Okay, it is only prescribed under the special conditions. Now, what is hyperalgesia? Hyperalgesia is increased the pain sensitivity due to noxious stimuli, meaning the stimuli which is responsible for the pain. Okay, the increased pain. Now, one more definition I want to add in this is pyrexia. Pyrexia is nothing but fever. Okay, fever. The basic term is fever. Next is so a body's core temperature is physiologically important as compared to the body surface temperature, meaning the inside temperature, the internal body temperature is more important compared to that of the body's surface temperature. Okay, there might be a difference between the temperature within the body as well as and the surface as well, and the temperature which is there on the body surface. Now, this hypothalamus, which is also referred as master gland, present in the center of the brain, and it has a major role in thermoregulation. It has a major role in thermoregulation mechanism because it controls the body temperature by two different mechanisms. First is cutaneous vasodilation, and the second one is increasing the sweat gland activity through a sympathetic cholinergic fiber. So this hypothalamus plays a very much important role in thermoregulation because it controls the body temperature by two different mechanisms, that is cutaneous vasodilation and by increasing the sweat gland activity. Now let's see how the hypothalamus manages to control the body temperature. So when the body the increase in the temperature is brought about by the hypothalamus, which reduces the heat loss by peripheral vasoconstriction. So in order to increase the body temperature, the hypothalamus what will do? It will reduce the heat loss. How so? By causing vasoconstriction. Due to vasoconstriction, there will be reduction in the heat loss, and thereby it will increase or it will rise up the body temperature. The another way is by if the hypothalamus wants to increase the heat generation, it can also cause it by inducing shivering. So here the best example is, let's in the winter, specifically in the winter, the person who is unable, who is who can't bear extreme cold temperatures, then that person might feel shivering, and this shivering is a kind of exercise which will generate a heat in the body of that person. Thereby this is the shivering action is generally due to the activity of hypothalamus. This shivering action is a kind of exercise which will generate a heat production, and thereby it will rise the body temperature in order to maintain or in order to cope up with the surrounding temperature. Now consider if a person have undergone a bacterial infection. Okay, maybe the person have fever. Let's consider the person is having a fever, or maybe due to the bacterial infection. So there was as per hypothesis this bacteria, the bacterial cell wall consists of lipopolysaccharides, and these lipopolysaccharides which is present in the bacterial cell wall will act as a foreign material to the human body, as it is going to activate the phagocytes. The phagocyte is one of the type of a defense mechanism. We can say the phagocytosis is a kind of mechanism which is carried out by the mononuclear phagocytes. This phagocyte gets activated in the presence of lipopolysaccharides. Okay, the foreign lipopolysaccharides which is present in the bacterial cell wall. These phagocytes then further, activated phagocytes will further release interleukin 1 and tumor necrosis factor alpha. It's a kind of signal. Okay, it's a kind of signal which these two signal, that is interleukin 1 and tumor necrosis factor alpha, will flow throughout the blood, and due to blood circulation this will then reach to the vascular endothelial cells present in the hypothalamus and stimulates the local synthesis of prostaglandins, that is specifically PGE2. We will be discussing prostaglandins in more details in my further videos. Now, just for now, understand this mechanism, basic mechanism of it. So, the hypothalamus these two factor, that is interleukin 1 and tumor necrosis factor alpha, will reach to the endothelial cells present in the hypothalamus, and it will stimulate the local synthesis of prostaglandin. Here more specifically it is PGE2 prostaglandins, and this prostaglandin will cause fever. Okay, it will cause fever and anorexia. Now, due to this fever, our body temperature is going to rise. It's a defense mechanism which is created by our body in order to fight against that foreign particle, that is foreign bacteria. Because as we know, the high temperature is unbearable for bacteria, and therefore our body try to produce the defense against that bacteria. Now, these prostaglandin inhibitors, most of these NSAID'S are there, no, that is non-steroidal anti-inflammatory drugs. These kinds of drugs basically act as a prostaglandin inhibitor. This will try to reduce the fever, that is, this will try to reduce the fever by inhibiting the synthesis of prostaglandin. It will inhibit the synthesis of prostaglandin, and thereby it will reduce the fever, thereby that is it will reduce the rise up in the body temperature. Thus, you can say that although interleukin 1 and tumor necrosis factor alpha, both these factors are produced by our body in response to that foreign lipopolysaccharide which is present in the bacteria, but these two factors will act as a pyrogen. Pyrogen meaning a fever causing agent. Pyrogen, what is pyrogen? It's a fever causing agent. It will act as a endogenous meaning something which is produced within our body. So it acts as an endogenous pyrogen, means it's a starting point, we can say, or those factors which is produced within our body will act as a pyrogen, that is fever causing agent, and along with other cytokines, that is other factors including cytokines, even cytokines are also responsible. It will play a major role in the manifestation of inflammation. It will activate our defense mechanism. All these will act as a endogenous pyrogen, meaning in response to that foreign particle, our body is producing these factors, all these three factors: cytokines, interleukin 1, and tumor necrosis factor alpha. So these three factors will act as an endogenous pyrogens, which plays a role in the manifestation meaning it plays a role to start a kind of inflammation. It will rise, it will increase our body temperature. There will be change in the environment of the body temperature. Okay, now this all this which I have explained now, the basic introduction, it's just a basic introduction about how like foreign particle enters and how our body responds in the form of fever. Okay, and how to reduce the fever is the reduction in the fever can be done with the help of non-steroidal anti-inflammatory drugs, which will prevent the synthesis of prostaglandins. And what's all these details about prostaglandins and factors and all will be discussing in my further videos. For now, just I have covered the basic introduction and the classification of these non-steroidal drugs. So after introduction, let's begin with the classification. Now these NSAIDs are classified into two: non-selective COX inhibitors and selective COX-2 inhibitors. Again, COX, what is COX-1 and COX-2, I will be discussing. Just for now, let's look into the classification. Let's go through the classification. First is salicylates and their congeners. Congeners meaning derivatives. The example of the drugs included under this category is aspirin, also referred to as acetyl salicylic acid, methyl salicylate, sodium salicylate salsalate, para amino phenol derivatives, phenacetin, and paracetamol, which is commonly marketed as crocin and dolo. It has antipyretic effect. Okay, paracetamol is an OTC product which is generally prescribed for fever. Third category is pyrazolone derivatives. Under this, phenylbutazone and oxyphenbutazone. Fourth category is indoles and related drugs, indomethacin and sulindac. Fifth is heterocyclic aryl acetic acid derivatives, diclofenac, tolmitin and ketorolac. Ketorolac is basically used for toothache. Sixth category is propionic acid derivatives, ibuprofen, phenoprofen, naproxen and ketoprofen. Basically this class is used for muscle pain. Seventh category is phenamates, flufenamic acid and mefenamic acid. Mefenamic acid is used during stomach cramps or those women who is undergoing severe pain during their menstrual cycle. Mefenamic acid is commonly used. Oxycams includes piroxicams. Second class is selective COX-2 inhibitors. It includes nimesulide, nabimutone, etodolac, meloxicam, celecoxib. Now this etodolac, celecoxib, these are generally prescribed for joint pain. Okay, joint pain, the person who is suffering with gout, this is having anti-inflammatory property. It reduces the joint pain. Nimesulide is not prescribed for children basically. So till now we have covered the basic introduction, what is non-steroidal anti-inflammatory drugs, its basic introduction including the terms such as pain, analgesia, hyperalgesia and pyrexia, overall introduction and the classification. Now there are certain points, that is prostaglandin, cytokines, these COX, this all terms I will be discussing in my further videos. Just for now, understand with the basic intro and classification. Okay, thank you. If you liked my video, then please share and subscribe to my channel and do comment. Thank you.